Welcome back, Dr. White, Gateway Health and Wellness. And if you're 14 days in, you've been tested positive for COVID-19, and you're 14 days in, and you still have symptoms. You still are a little short of breath, fever, your fatigue, muscle aches and pains are about halfway gone, but they're there, and you're wondering, okay, 14 days, I thought it would be gone, but it's not gone. First thing you want to do is get retested, okay? And because we have to go on how you're feeling. If you're not feeling better, we want to get you retested, and then we want to continue the quarantine process until you start to feel that your symptoms are about gone. You're feeling better, no fever, you're not short of breath, you don't have the muscle aches and pains. It's about 3 or 4 weeks now, and you feel like you're almost back to normal. Okay, so now what we do is retest, make sure you're negative, and then there's another test called the antibody test. And that antibody test will tell if your body, if your immune system has mounted a response against the virus. And there's a lot that goes into actually both of these tests, but this antibody test will tell us if how much antibody, and it'll quantify things. And so we'll know that you're negative for the virus. You have very, 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 very low a virus in you, and then also we'll know that your antibody levels are high enough. At that point, again, we want you to, it would be okay for you then, after you've seen your doctor, to re-enter into the society, your family, your work, etc. But at this point, you really want to follow the guidelines, the social distancing, the mask, the washing of the hands. All of those things become very important, because chances are you still may be shedding a small amount of that virus. May or may not be contagious to people, but at that point, because you've had sort of a rocky course with this, you want to make sure that you always have your mask on when you're around other people, and that you're constantly washing your hands, making sure that you're not spreading any of that virus that you may or may not have at that point, and continuing with the social distancing. And so those are the things that we want to know. Those are the things that you need to know about that 14-day. Because sometimes it's 14 days, and sometimes it's a month. And so if you have questions, you can ask us on Facebook. Our Facebook is there, or you can call our office, and we'll answer your questions regarding COVID-19. Thank you.